My name is Erica. I'm one of the interns here at Burwash Equine Services, and today I'm going to be talking to you about causes of non-weight bearing lameness in the horse. So my presentation is called Bear With It. When we see a horse that presents for significant lameness or non-weight bearing lameness, there are 5 main things that we think about: fracture, joint or tendon sheath injury, a soft tissue injury, a foot abscess, or cellulitis. And these are the 5 things that we always have in our head when we see a horse that's non-weight bearing lame. So throughout this presentation, I'm going to be going through all these 5 things and talk about specific signs to look for, as well as diagnosis and treatment. First up, we have fracture. In the horse, the most common places for fracture are in the legs, usually below the level of the knee or the hock. So the most common places are in the cannon bone, also known as the metacarpal or the metatarsal, as well as the splint bones, which are located just behind it, as well as some of the bones lower down, like the pastern bones or the coffin bone. We do occasionally see fractures higher up on the leg, such as the radius, the humerus, or even the scapula on the front leg, or the tibia, the femur, or the pelvis on the hind leg, but those are a little bit less common. In terms of specific signs for fracture, usually they're not bearing weight. They might be down and unwilling to get up. They might be lame or really reluctant to move, and they may have swelling at or below the area of the suspected fracture. Now, these signs and their severity depend a little bit on what bone is fractured. For something like a broken splint bone, the horse may still be able to walk, but may be lame, whereas something like a broken cannon bone or a broken radius on the front limb, they're usually pretty traumatic and they usually don't bear weight at all on that leg. For diagnosis of a fracture, the absolute best way to diagnose it is with an X-ray. Here are a few examples of different fractures that we could find on X-ray. So you see this, the first picture is of a broken radius just above the knee there. The second picture is of a broken splint bone. The third picture is a broken cannon bone, and the fourth picture is of a broken pastern bone. So these are all the different types of fractures that we can see, as well as many more, but X-ray is by far the best way to diagnose them. Occasionally, for really severe fractures, we may be able to diagnose them on palpation, but usually we like to take X-rays to confirm. For treatment and management of a fracture, the first thing we usually want to do is confine the horse, whether that be get them into a stall or put up a pen around where they are in the pasture, depending on where we find them and how severe we think the fracture is. We don't want the horse to be trying to walk around or run around on it, as that can make the fracture worse. So we definitely want to confine them. The second thing that we think about is stabilizing the fracture. In the short term, that often involves a thick leg bandage or a leg bandage and a splint, depending on where the fracture is. In the long term, some fractures can be managed with a thick bandage and strict rest, but often stabilization will also involve surgery, whether to repair the fracture or remove the fragments. It varies a little bit with which bone is broken, but often they do involve surgery. The other thing that is key for treatment of a fracture is pain management. Obviously, fractures are very painful, and they will heal better if their pain is under control. So that's definitely another key thing that we think about. And then unfortunately, since the horse relies so much on their legs to carry all their body weight, and they are heavy animals, often, especially when the fracture is higher up in the leg, there isn't a lot we can do. We can try to repair them surgically, but even with surgical repair, a lot of fractures don't do well afterwards on recovery. So unfortunately, humane euthanasia is often the result of a lot of fractures. The second thing that we think about when we see a horse with a non-weight bearing lameness is a synovial structure injury. So a synovial structure is something like a joint or a tendon sheath, and it's basically just something that contains synovial fluid, which is a lubricant. So this could include wounds that communicate with a joint, like a puncture wound into a joint or something like that, or a laceration that involves a tendon. So if a horse gets a deep cut on the back of their leg, it might go through the tendon sheath that surrounds those flexor tendons. So those are also common injuries that we see. So signs of a synovial structure injury may include a swollen joint. The joint may be warm or painful to the touch. The horse may be significantly lame or may be reluctant to move. I have a note on the bottom of the slide that they're not always as lame as we expect, especially if the synovial fluid is draining. So if the wound communicates directly with a joint or a tendon sheath and it's right after it happened, the horse may not be so lame because the synovial fluid is able to drain. When a synovial structure gets irritated, they produce more synovial fluid, so they produce more lubricant. And if the joint is closed, or maybe the joint has started to heal, but is still irritated, they will have a pressure buildup due to the excess synovial fluid in the joint, and that is usually what makes them significantly lame. So depending on when the injury occurred or what type of injury it is, the horse may be super lame, but they also may not be as lame as we would expect. For diagnosis of a synovial structure injury, there's two main ways. We can sample the synovial fluid if there's no wound draining, or if we're not sure if the wound is communicating with the joint or synovial structure. So we can take a sample of it, or one thing that we often do for wounds to see if they communicate with a joint or a tendon sheath is we put a needle in the structure and then we add sterile saline to it to see if the pressure buildup causes the fluid that we're putting in to drain out the wound. If it's communicating, then it will drain, but if they're not communicating, then they often won't drain. For treatment of a synovial structure injury, often we will take those to surgery just so that we can clean them up really well and give them a really good flush under general anesthesia. Usually that will involve arthroscopy as well to look in the joint or the tendon sheath and clear out any of that irritated material on the inside. We can also just do standing joint flushes where we sedate the horse and perform a flush like we would under surgery. It's just usually not as thorough. And then other key principles of treatment are to eliminate or prevent infection, so often that involves antibiotics, as well as pain management. As I mentioned, for fractures, everything's going to heal better and we'll have less complications if the horse's pain is under control. So the third differential that we always have on our mind is a soft tissue injury. So this includes an injury to a muscle, tendon, or a ligament. Often it's trauma, so the horse has whacked its leg or been kicked, or a strain, so they just take an odd step and just overstretch those fibers. And most commonly it's the tendons of the lower limbs that run along the back of the leg. I have a diagram here of the main ones that become injured. So this is an example is we have the superficial digital flexor tendon on the very outside of the leg. Then we have your deep digital flexor tendon in the middle there, and then your suspensory ligament, which runs directly behind the cannon bone in between the splint bones. On the front leg, you'll also have the check ligament, which is just a branch of the deep digital flexor that's found in the upper half of the leg in between the deep digital flexor and the suspensory ligament. And that's usually found on the front limbs. So these are the most common areas that we see. So for signs of a soft tissue injury, they will usually be lame. They will be varying degrees of lame depending on which tendon or ligament or muscle is injured. You'll often see swelling of or around the injured area, and the area that is injured may be warm or painful to the touch. So for diagnosis of a soft tissue injury, the best thing we can do for this is an ultrasound. I have an image here that shows some of the structures that we would look at. So from outside to inside, you have your superficial digital flexor, your deep digital flexor tendon, your check ligament, and your suspensory ligament. And the image on the other side of the slide here is an example of an injury in the superficial digital flexor tendon. So you can see directly in the middle of the tendon there's a black circle. which indicates fiber disruption and injury. Often soft tissue injuries will take a few days to show their full extent. So we always like to ultrasound these when they first happen, but we will often come back and ultrasound them a few days later as well, just to see how big the actual injury is, because it takes some time to reveal itself. For treatment and management of a soft tissue injury, often this involves a prolonged period of rest, and then we always want to control the pain and the inflammation. As I mentioned before, everything heals better when the horse is comfortable, so that's definitely a key part, is managing pain. And then managing inflammation as well in the area, especially if we're right in the acute stages, so right after the injury happened, we want to do what we can to try and minimize the inflammation in that area, which often goes along with pain management as well. After a certain period of time, we want to introduce controlled exercise and rehabilitation, and often the rehabilitation plan will progress as the horse progresses in their recovery. And that's something that we like to monitor their progress as well with continual ultrasounds, just so we can see how the injury is healing. And then the other option we have for treatment of soft tissue injuries are some different supportive medications. So something like platelet-rich plasma, IRAP, which is just a fancy kind of protein, hyaluronic acid, which is a lubricant, or even stem cells. And these are different modalities that will help different lesions. So that's something that we can evaluate using ultrasound once we diagnose it, of which one of these things might be the best for that injury. So the fourth thing that we think about when we see a horse that's not bearing weight is actually a foot abscess. Foot abscesses can often present like the horse has a broken leg, like they can be very, very sore on these. So it's always something that we think about. So a foot abscess is actually just a local infection in the foot. And there's a couple of different causes that include bacteria entering the junction between the sole and the hoof wall, so right along the white line. That's often where bacteria gets in and can form an abscess. They can also be caused by a puncture wound or penetrating injury to the sole of the foot. We tend to see more foot abscesses when the environment is cycling between wet and dry, because the foot gets wet, and then as it dries out, it kind of cracks and shrinks the sole a little bit, which can predispose the sole to get bacterial infections in there. And then the other thing that can cause a foot abscess is a hoof bruise. So if the horse steps on a stone, that bruise can turn into an abscess. So for signs of an abscess, as I mentioned before, they can be pretty lame with a foot abscess and not wanting to bear weight on that limb at all. Often they have an increased digital pulse, which we feel down around the fetlock area. They might have heat or swelling at the coronet band, depending on where that abscess wants to burst out of. You may see evidence of a puncture wound in the sole of the foot, so especially if you ever find a nail or anything stuck in the bottom of your horse's foot, we definitely want to know straight away before you even pull it out. And also you might see a draining tract, so when you pick up the horse's foot, the abscess may already have burst and be draining out the bottom of the foot. For diagnosis of these guys, typically we want to do our physical exam, and we especially want to feel those digital pulses. We'll often apply hoof testers, which you can see in the picture, which we feel around different areas of the foot and on the sole. And usually if they have an abscess, they'll be reactive to the hoof testers when we squeeze in that area. And occasionally, if we're not sure, some abscesses can be diagnosed on x-ray. It would just look like a little black pocket on x-ray. This isn't always done, but it's something that can be helpful if we're not too sure what's going on. For treatment and management of a foot abscess, again, we want to manage their pain. Sometimes that involves like oral medication, like we would with the other injuries. Sometimes that actually involves treatment. Often once the abscess is draining, the horse is a lot more comfortable. So that's the second thing we want to do, is try to allow for drainage. So usually that involves us or a farrier coming out to see if we can find where the abscess is and see if we can start to open it up a little bit to allow it to drain. The other thing we want to do is protect the hoof sole, or protect the hoof so that wherever that abscess is draining out of, we don't want any new bacteria to get in there, which is what we have there in the bottom. We want to prevent further infection, and those kind of both go along together. The best way we do this is with a foot bandage, and often in this case we use duct tape and diapers actually, so that's basically all you need for a good hoof bandage. And then the final thing that I'm going to be talking about in this presentation is cellulitis. It's something that we do commonly see in horses that are present for being very lame. And cellulitis is a bacterial infection in the skin. It can be caused by blunt force trauma or often wounds, and basically just the disruption in the skin integrity allows for the bacteria that normally lives on the skin to get deeper in and causes that infection. Cellulitis is more common in the hind limbs, but it can be found in the front limbs as well. And it can start and progress very quickly, even in the span of a couple hours. You know, you go out in the morning and your horse is fine, and then you come out at lunchtime or later in the afternoon and the horse's leg is swollen and is super lame. Cellulitis can happen that fast. So for signs of cellulitis, often the horse will have a fever because it is more of a systemic infection. The horse's leg is usually firm and swollen. The limb might be warm and painful to the touch. Often if they have a severe cellulitis, the horse doesn't like you to touch anywhere on that leg. The horse is usually pretty lame, and as this presentation suggests, they might even be like not bearing any weight on the leg, and so they're often reluctant to move as well. For treatment and management of cellulitis, we want to keep the limb protected. So we usually apply a bandage, which also helps to reduce the limb swelling. We put a pressure wrap on there to try and keep the leg protected and also bring down the swelling. The other thing we want to do is eliminate infection because cellulitis is caused by a bacterial infection in the skin. So often that involves antibiotics, and the type of antibiotics will depend on the horse's history and how long the cellulitis has been going on for. And then again, like with all of the other things that I mentioned on this presentation, we want to manage their pain as well and keep them comfortable so that they're still able to walk and be comfortable. So those are the key principles for treatment of cellulitis. And that is the end of my presentation today. So if you ever have a horse that you think has one of these things, or you ever have a horse that's non-weight bearing lame, these are the things to keep in mind. These are the things that we will be thinking of when we come out to see them. Thank you.